The brain is the only organ in the body that actually has a security guard from the outside. The human body is programmed to reject anything that it doesn't recognize as its own.
Talking about stem cells, sir, I've heard you say that stem cell therapy, there's no drug, it's no surgery, it's a biological repair.
Yeah.
Can you explain this, please?
So up to now, we had two kinds of medical treatments. Either you gave a medicine, a pill, a drug, an injection, something that was pharmaceutical, or you did a procedure. You went and cut, chopped, removed, sutured back. So either there were procedures or there were used products. Cellular therapy, what is also now called regenerative medicine, is something where you're not using a drug or a surgical procedure, you're using biological tissue. Like earlier, we could first, there's transplantation. You can transplant a kidney, you can transplant a heart, that's an entire organ. So there's organ transplantation. Then you have tissue transplantation, like, you can take the skin from somewhere and put it somewhere. You can take a bone from somewhere and put it somewhere. So this is tissue transplantation. A bypass surgery, you take a vein from the leg or the hand and put it in the heart. So this is tissue. So there is organ tissue. But over the last 3 decades or so, there has been interesting research into cellular. So cells are a basic building block. Like you have a wall, so a wall is made up of bricks. So the bricks are like the equivalent of a cell. So if an organ is an entire floor, the room would be the tissue and the bricks would be the cells. So research has shown that when you transplant healthy good cells, they have the potential to repair damaged cells. So this regenerative medicine of two types. You have what are called stem cell products. These are companies who manufacture them from. So there's the umbilical cord, which is normally the cord that connects the mother and the baby, which are normally thrown away in the garbage. But there are some companies who collect it because there are some stem cells in there. They package it, preserve it, and they sell it as a product. What we do is a procedure. So we put a needle into the bone marrow, take out the liquid in the bone, which is called bone marrow. We separate the cells that we want from it, which are called mononuclear cells. And then we inject it through a very thin needle into the lower back. Why in the lower back? Because there's a fluid in the lower back called cerebrospinal fluid. When we inject it into spinal fluid, it goes all the way up to the brain. So you don't have to actually enter the brain. So we do cell therapy procedures as compared to stem cell therapy products. We don't use those products. Now, so what this does, basically what it does is there is damage. There's some cells that are damaged. You put good cells, they will go and repair the damage. That's it. So it's a cellular repair at a very fundamental level. The cells are the basic building block of the whole body. Our body is finely made up, if you look at us, there's skin, there's bone, head, heart, lung. You go down, and finally everything is made up of cells. So repairing, that's the beauty of this treatment. You're not doing anything from the out there, repairing things fundamentally inside out.
So let's go to the specifics of it because the parents need clarity. So you've mentioned the stem cells, how you inject. My first question here is, why do we take our own fresh cells compared to, let's say, we get the cells in the market, which are of good quality? And second, why do we inject if straight away we can give it an IV and it goes directly where we want? We inject twice the patient and then we take a chance through spinal fluid to take the cells to where we think it will take. So instead of doing this, why don't we just IV?
So there are two parts to it. There is a difference between the two cell types and there's a difference between the way it is given. All right. So to put it in a nutshell, the difference between using those preserved cells, which are manufactured by companies, and taking cells from your own body is the difference between having a canned orange juice from the supermarket versus taking a fresh orange and serving fresh orange juice. So I want to ask you, which is healthier? An orange with fresh orange juice or a canned orange juice of any brand? Which is healthier?
Who's the first?
So that's the fundamental difference. Now, I'll explain to you now slightly technically. So those cells, which are for donor cells, like I said, what companies do is they go to nursing homes where babies are delivered. They collect this umbilical cord from multiple hospitals. Normally, like I said, after birth, this is discarded. It was thrown in the garbage. So they collect it. They take it to their manufacturing facility. From the umbilical cord, there is some blood there which has got these stem cells. And then they, of course, go through a process of refining it. And then now this has to be preserved. So there are two things. You have to add a preservative to it. Now the preservative for stem cells, it's a long word, but its short form is called DMSO. It's the only thing that can preserve stem cells, DMSO. But DMSO is harmful to the brain, right? That's why you can never inject preserved cells in the spinal fluid, because if any of the preservative goes into the brain, it will cause more damage. That's the reason why it has to be given intravenously, because the blood dilutes the preservative. So first thing, in the donor cells, they have a preservative which is harmful to the brain. In the autologous cells, there's no preservative, nothing. It's just fresh, right? Second, those cells, donor cells, they are preserved at several minus 40 degrees, even more sometimes. So it's cryo-frozen, because when you preserve something, it has to be frozen, right? Ours are and then when you have to give it, you have to bring it back and thaw it, bring it to room temperature and then give it. Ours is at room temperature. Okay? So if I ask you, is something with a preservative more healthy or something without a preservative? If I ask you something which has been cryo-frozen and kept for several weeks or months or even years and then given to you, versus fresh which is taken just now, okay, which is healthier? Also here we know the source, because this is from our own child. So here we know the source. It's taken from our body, put it back into the body. There we have no clue from where this has been collected, which hospital is being got from, and it's got cells from multiple donors. You understand? So we don't know the source. I'm not saying there's anything wrong, but it's unknown. Okay, whereas here it is known. Also, technically, the body tends to accept its own cells much better than cells of anything from the outside. The human body is programmed to reject anything that it doesn't recognize as its own, right? So this is the broad difference between the types of cells. Now the mode of delivery. So because the preserved cells have a preservative, they cannot be injected directly into the spinal fluid like how we inject. So you have to give it what is called intravenously, like how you give any injection. Now when you give IV, it goes first from here to the right side of the heart. The right side of the heart sends it to the lungs. The lungs then send it to the left side of the heart, and the left side of heart sends it to the brain. Now, in this process, a lot of cells get trapped in the lungs, because there are some papers that show that maybe up to even 50% of the cells may get trapped in the lungs. So they don't even get to the brain. They all get trapped in the lungs. They'll help in, whatever purpose, but they're trapped there. Also, once they get to the brain has a protection system. It is called the blood-brain barrier, BBB. The brain is the only organ in the body that actually has a security guard. So what do I mean by that? It means all our other tissues, like muscles, let's take muscles. Where do muscles get its nutrition from? From the blood. So there's glucose in the blood, there's protein in the blood. From whatever we eat, it's in the blood. From there, it goes directly into the muscle. The muscle doesn't decide what it wants. What's in the blood will go in the muscle. Same thing is true of the heart, liver, kidney, everything else. The brain is the only part that's been given a security guard. Whatever in the blood can't enter. Nature has given it a protection saying that if something is harmful, I will not let you enter. Now, like I said, this protection system is the BBB, blood-brain. It's called the blood-brain barrier. It's a barrier between the blood and the brain. Right? Now, there's a possibility, we don't know for sure, that some of these cells may not be allowed to come inside. Okay. Now, we completely bypass the blood-brain barrier because we are not giving it in the blood. What we do is we put a needle into the lower spine. There's a spinal fluid. This spinal fluid is completely bathing the brain and the entire nervous system. The brain gets some of its nutrition from here. So we bypass that and we have put it directly where it is needed. So these are the broad differences between preserved donor cells versus fresh autologous cells that we use, both in terms of the nature and method of delivery. Now we did use in COVID, our hospital was converted to a COVID hospital, and there we had done a research clinical trial on stem cells in COVID. Now there we wanted the cells in the lungs. Okay, so we gave it IV. Yes. So there we used donor cells and we gave it IV, and they all went in the lungs, and we got some excellent results. We even published that as a scientific paper and showed that there were a lot of benefits using that. So We are not averse to using it, but I don't believe it should be used for brain or neurological problems. Maybe used for lung, it may be used for other things, but not for the brain.
But the one part, okay, they're trapped in learning, that's one problem. So yes, you used it in COVID. But if you said they come with the preservatives, obviously, is that okay to be given directly with preservatives going to the lungs?
So what they do is they try to remove the before you. I mean, the preservative preserves it. Now there's a process when you're using it, you tend to minimize that. But when you give it in the blood, what happens is the blood dilutes it. So even if there's a preservative, in the whole bloodstream, it sort of gets diluted. So we are not sure how much of the preservative is still there in that. It might be tumor, whatever. In the brain, it will not tolerate at all. It will cause a very severe reaction. Whereas in the blood, by the time it gets to the lungs, it's all diluted.